This presentation will provide you with an overview of the social emotional evaluation written by Elisabeth Wiig, Ph.D., and published in 2008 by Super Duper Publications. It comes ready to use with students. This assessment is criterion referenced and is designed to evaluate aspects of emotional and social awareness and a student's competence in these areas. The test can be used with any students as long as they are between the chronological ages of 6 years 0 months and 12 years 11 months. It takes about 1 hour to administer, but of course is dependent upon each student's response time. You will administer at least 4 subtests. You might need to administer the supplemental subtest. Both the educator and the parent or guardian should complete a social emotional questionnaire. The supplemental subtest is optional because students need to recognize facial expressions for the subtests. Some students may need practice with that. In that case, go through this subtest. Subtest 1 asks students to identify common emotions, such as happiness, surprise, or boredom. In this example, the examiner says, point to the face that is happy. Subtest 2 asks students to identify emotional reactions, identify their causes, and name the feelings. In this example, the examiner says, look at this person. Point to the picture that makes him feel that way. This will score a student's receptive ability. Then the examiner asks, how do you think he feels? This will score a student's expressive ability. In subtest 3, students are asked to explain social gaffes. They will identify the correct or incorrect behavior first, then tell how to correct the behavior. In this example, the examiner asks, is everyone doing the right thing in this picture? A receptive question. If the student says no, then the examiner asks, who is doing the wrong thing? What should she have done? Those are expressive questions. In subtest 4, students will demonstrate their ability to understand conflicting messages. In this example, the examiner asks, is everyone doing the right thing in this picture? A receptive question. If the student says no, the examiner asks, who is doing the wrong thing? What should she have done? Expressive questions. To administer this test, you won't need much as the materials are mostly provided. You will need a pen and either a CD or internet access on a laptop to play the scripts for subtests 3 and 4. If you like math, the examiner's manual explains how to calculate a student's chronological age. If you prefer a tool, download the Super Duper Age Calculator, available for Apple products and Android. Once you have the raw scores and know the student's chronological age, the examiner's manual has tables in Chapter 5 that provide you with both z-scores and percentiles. Receptive and expressive scores are scored separately, but then put together to create the final z-scores and percentile ranks. To understand the scores, here's a brief refresher. A z-score is the most basic standard score and expresses how far a student's score is from the mean based on the number of standard deviations. Matching the mean equals 0. One standard deviation above the mean equals a score of 1. 2 standard deviations below the mean equals a score of -2. As you can see in the table, students that score above 0, the average or mean, are considered above average. Percentile ranks let evaluators and educators see where the student falls in comparison to other students. For example, if a student scored a percentile rank of 87, it would mean that they performed better than 87% of the other students in his norm group. For normative data, this assessment evaluates the social skills and the higher level language that students need to interact successfully in everyday situations at home, school, and in the community. In addition, it is ideal for identifying social and emotional language needs of students with autism spectrum disorders, emotional disorders, learning disabilities, or attention deficit disorders. Chapter 5 of the Examiner's Manual provides tables for determining z-scores and percentiles in 3 categories: normative data, autism spectrum disorder, and language and/or learning disability. For the latter two, scores are only meant to give insights regarding students' performances when compared to students with similar diagnoses and can be used to monitor progress in treatment. This evaluation has been shown to be valid and reliable.